Hi, my name is Brett Johnson. I'm an associate marriage and family therapist working at SoCal Therapy Center in Woodland Hills, California. And today I would like to talk with you about a serious issue affecting many people, unfortunately, and that's depression. Depression affects 1 in 12 teenagers, 1 in 3 college-age students, and over 15 million adult Americans. Depression is the number one reason why people seek out mental health support. Depression is not something that you should try to deal with by yourself. Depression can be very debilitating. It's a medical condition. If you or someone you know has depression, and I'll talk about the symptoms of depression in a second, please seek out medical help. Depression is the number one debilitating factor for people ages 15 to 44 and can even take a life. So I encourage you, or if you know somebody who has depression, please seek help. It is a treatable mental health condition. So what does depression look like? What are the symptoms of depression? Depression is most easily categorized by its low mood. So meaning that somebody who has a low mood doesn't have a lot of energy. They don't really get excited about things. They may not even want to get out of bed. They don't feel a lot of energy. So things that they used to do in terms of having good grades, you might see a change in their grades. You might see a change in how they eat. Somebody who's depressed might not eat as much as they used to, and you can see a change in their physical appearance. Sometimes along with depression can come anxiety. So somebody might become more anxious and avoid doing things they used to do. Also, sometimes with teenagers and young adults, we see them, people with depression, we see them turning to drugs or alcohol as well as a way to escape. So depression can be very debilitating, and it can suck the life out of a person and even put their life in danger. And that's why I really encourage you, or if you know somebody who's struggling with depression, to please get help. So we don't really know what causes depression, unfortunately. There are a number of factors, biological, psychological, other social factors that play a role. Oftentimes we do see people who have depression, they know a family member who was depressed as well. So it does typically run in families. But it can also be the result of just various life experiences that people sometimes encounter, or just a combination of those factors. But the good news is that depression is treatable. I'm a CBT practitioner, cognitive behavioral therapist, and I treat depression by working within the thoughts, feelings, behavior model. So I will interview you and work with you to understand what is causing your depression. I'll understand your family history if there is a biological cause. I'll assess where you are in life right now, what goals you're trying to accomplish. Are you trying to complete a degree? Are you trying to find or keep a job? Have you recently lost a loved one in your life? So we look at all those factors that could be causing depression, then also maintaining depression. And then I'll work to help you change the way you think, feel, and behave according to your depression in a way that will lead you to ultimately feel better. And when you feel better, you'll start to think better. When you think and feel better, you'll start to behave differently. When you start to behave differently, it'll change how you think about or how you experience life, which will then change how you feel about life. And it's just a kind of a system that works together. That's what cognitive behavioral therapists treat as that system of thoughts, feelings, and behavior, and get you back to working on building a wonderful life for yourself. So again, my name is Brett Johnson, Associate Marriage Family Therapist at SoCal Therapy Center in Woodland Hills, California. Our phone number is 818-804-0322. My email address is brettsctc@gmail.com. It's BRETTSCTC@gmail.com. So please share this message. I encourage you or or if you know somebody who's struggling with depression, to give a therapist a call or speak to your doctor about it. It is a difficult mental health condition, and you can get some help for it. So thank you.